Well, hello, everybody. Good afternoon or good morning, depending on where you are. I guess it's afternoon pretty much most places at this point. My name is Garrett Schmidt. I am the managing editor for BBC Exhibit Hall, and I would like to welcome you all to today's live webinar hosted by Lucerna Health and joined by Sanitas USA. And it is titled Patient and Provider Engagement, Next Gen Health Engagement. We're going to discuss better health and better outcomes today and a lot of great material. I got a little sneak preview when we did our practice run, and I think you guys are really going to enjoy the material today. A few items of note before we get started. This is a traditional webinar format, so everyone has joined in listen-only mode, so you don't need to worry about muting your mic or turning off your camera or anything. Don't worry, we can't see it. But we do want to hear from you. And we are going to have a time towards the end for some Q&A to where we can field your questions and ask our speakers today. So at any time during the presentation, if you have a question for either of the speakers or just in general, go ahead and add it in your question module. And we're going to get to as many of those as we can during the allotted time. If for some reason we don't get to yours, don't worry. Someone will reach out via email afterwards and make sure to answer your questions. So we're going to get to as many as we can. Also, today's session is being recorded. So what's going to happen is when we're done, you'll receive an email about an hour or so afterwards from one of us, and there will be a link to the recording and also where you can download the slides and interact with the team there. So keep an eye out for that email. Everyone will get a copy of the slides today, and not just those who attended, but anyone who registered. So if you have to drop off early for some reason, you'll get that as well. Finally, I would like to very briefly introduce our speakers. We have with us today Dr. Juan Estrada, who's the CEO of Sanitas USA. So welcome, Dr. Estrada. And we also have Mr. Craig Thomas, and he is the co-founder and CEO of Lucerna. So very happy to have you gentlemen with us. Hello.
Good to be here, Garrett.
Thank you.
All right, I'll turn it over to you guys to take over from here.
Okay.
Great. Thank you so much, Garrett, and thank you, Craig, for the invitation to this webinar. So like Garrett said, I'm Juan Estrada. I'm the CEO of the delivery system at Sanitas USA. And I'm also the CEO of the joint venture of GuideWell Sanitas that we have with our good partners of Florida Blue in the state of Florida. My background is medical. I'm a physician. I'm an internist, and I've been with the organization since we started here in 2015. Just for some context and history for the folks that have not heard of Sanitas, we are part of an international healthcare company that goes by the name of Keralty. And Keralty has presence in 9 different countries internationally, headquartered in Colombia in South America. And we had the luxury and the pleasure to start our presence in the US with Florida Blue back in 2015. So as I mentioned, I joined the company back then when we were just starting, partnering with Florida Blue and thinking how we could build a differentiated healthcare model in Miami, back then only focused in the Hispanic market initially. So as you can see here, this is the current state of the things we're doing in the US and in Florida in particular. But in 2015, when we started, it was only primary care services. We started with 3 locations, focused only on primary care. If we fast forward to 2024, you see the picture that we have here. You know, we built over 50 primary care clinics in the state of Florida, covering multiple regions in the state, and only focusing and also focusing on the holistic view. So we don't want to do only primary care, but we want to be outside in the community with our community-based services, doing behavioral health, a lot of focus on the mental health component. Most recently, we've added to the ecosystem advanced urgent cares. The level of complexity of patients that we can manage in our health system is quite broad these days, and slowly adding more capabilities to the health ecosystem, all working together with our partner Florida Blue to really identify what is needed, where we can make impact in patient care, in health outcomes, in cost of care, and really a very tight relationship with them. Uh, all of this in collaboration with Lucerna. As we'll go through the next few slides, we'll explain how the relationship and the platform and the work has been pivotal in the growth of our company. Craig.
Yeah, thanks, Juan. It's quite a story, and I've been fortunate to be involved in it in different ways. Back when I was at Florida Blue in the beginning, a tour at Sanitas, and of course Lucerna Health for 5 or 6 years. And uh, welcome everybody. And Juan, thanks so much for joining. So Lucerna Health, we are a technology and services company. We've built our team and our products and services over the last 6 or 7 years, specifically to help power, co-pilot what we call health ecosystems. And they could be like the joint venture that Juan described between a payer and a provider. It can be a hospital system that's adding ambulatory assets and wants to coordinate across inpatient and outpatient. It could be a primary care group on its own with an ecosystem of specialists. Um, we've been very fortunate to build our company inside this JV, so we believe they keep us on our toes, and challenge for sure. And we believe then our products and services, are practical and they actually work in this environment. And if you look just real quickly here at the picture on the screen here, everything starts with the Leap platform. We're a tech-first company because we believe data-driven insight connected to business processes is what really makes all of this work. And then we also think you need to have experienced, talented services team to help, customers somewhere along this circle here. Different people are in different places with different priorities, and often need help, whether it's acquiring consumers, integrating data and processes and insights, or engagement, which we're going to get into a little bit more today around that loop. So that's us. We're here in the East Coast, and our engineering team is out in Salt Lake City, and we'll share a little bit more of our story and how we looked at advanced engagement. And I think we're going to go to a poll here.
Okay, yes, we are going to have a poll for the audience. So you're going to see a question pop up on your screen and momentarily here, and then go ahead and select one. Okay, and the question is, what is the biggest challenge to engaging members or patients in their healthcare? And this is a select one, and we'll just give it a moment for the results to come in here. And this is anonymous, of course, so no one else will see what your results are, but we will show them so you'll be able to see where your colleagues are at. So we've still got some answers coming in, so we'll just give it another few seconds, and we'll put the results up momentarily. Okay. I think most of the answers have come in, so we'll go ahead and shut it down in about 5 seconds. About 5, 4, 3, 2, and 1. And then I will end it. And we got another one coming in. But here we go. I'm going to go ahead and shut it down, and we'll go ahead and share the results. Here we go. All right. Are you guys able to see Dr. Strada and Craig? Are you able to see the results here?
Yes.
Yep. Juan, do you want to comment first?
Yeah,
The audience?
absolutely. I'll take a stab at talking about the results. So the top one is challenges accessing and navigating the health system. Not surprising. I think we've all faced these challenges and these problems when we've used the system and when we've been on the side of the delivery. Uh, I think how the healthcare system in the U.S. is built with the fragmentation, the financial incentives, it definitely does not make it easy as a consumer or as a patient to access the system. That's I think that's where we've been focusing on a lot with Lucerna and with our partners is how do we change that? How do we turn that around? And there's a lot of strategies that you can put in place that we'll go through in the next few slides to make it easy, to make it continuous. I think that one of the problems that we face, at least on our side, on the primary care and specialty care, is the bouncing from doctor to doctor on the primary care side, which leads to poor experience, poor service, poor provider experience as well. So there's a lot of things and a lot of technology processes that we put in place to solve for that.
Yeah, I'll just add a little bit real briefly here. Um, with the the way the votes are spread out there, they're probably all challenges, depending on your perspective and where you sit. And it isn't a surprise. The patient member experience in healthcare isn't as good as it is in other industries like retail or financial for a lot of the reasons, here in the poll. So if you believe that engaging members or patients in their healthcare is important part of the future, you need a solution set that solves these problems. And there's probably more, particularly if you're a patient who's sick, trying to navigate the system and understand your options and get the support you need. So thanks for responding to the poll. And Juan, you have another?
Yeah, I just wanted to make an additional comment, Craig, on the lack of personalized messaging or responses, because it is true, but I believe that is very much related to the time you give to the clinicians to practice the right medical standards of care. In typical fee-for-service models, you see a lot of patients in a day. You have very little time to engage, interact, and deliver the right message. So that's what we also work on turning around with different type of value-based models, where we give the clinicians that time, enough time to interact, to ask the right questions, and to provide what the patient is expecting from that visit. So I just wanted to add that, Craig.
Great one, thanks. So the way we're going to go through the rest of this is talk a little bit why we think these collaborative ecosystems are the best pathway to what you might think of as next gen engagement. In the middle here, a little bit about what do you need to put in place and how to activate it and be effective and drive results. And then we'll wrap up with the other side of the coin, which is provider engagement. Okay. We're going to split this up here. A little bit of history, a little bit of storytelling, I guess, for context. And Juan, you can correct me if I'm wrong, if I'm not remembering some of this stuff right. But there was a lot going on when all this this case study here, and this is really a case study of the Florida Blue joint venture with Sanitas. In the marketplace, you had the Affordable Care Act rolling out, which obviously was a big deal. You had value-based care starting. I was at Guidewell Florida Blue at the time, and I think we were a very forward-looking company. And we were one of the earliest leaders in transitioning from what we call, to what we call a health solutions company. And the idea there was to get closer to the delivery of care, closer to providers, closer to our members to have a better, be in a better position to support patients, improve outcomes, and lower costs, all those kinds of things. So, and we were also advancing our consumer strategy. We were always leaders in the individual market. The market was expanding. It was very competitive. So, we started with some objectives before we met with Sanitas somewhere in that time frame in Colombia. And, we wanted to improve access to care, really primary care throughout the state, and in particular, underserved communities, underserved populations. We wanted to be able to hook up or match our members with the right provider in the right time, and then run a good, collaborative, transparent joint venture to change that relationship between the payer and the provider from, a contractual, transactional type arrangement to deep collaboration. And that became the JV, which I think is probably the fastest growing, largest payer provider VBC alliance joint venture in the country. It's been pretty amazing, and I think just a little shout out to the leadership at Guidewell Florida Blue and Corralty Sanitas for doing a tremendous job and having the courage. This transformation stuff is not easy, but I think you'll see here the results are worth it.
Yeah, yeah. You're right, Craig, and I think you mentioned something that's really important is the integration, the alignment of the vision, the values of both organizations in this joint venture with Florida Blue. That has been the key to making this the success it is today. And as you said, we'll show some results briefly. Just to mention a few things here on the right side of the slide. So the health ecosystem integration it has always been very, very important for us. We started as a primary care group, but we've never wanted to stay as a primary care group because we understand that a lot of things happen outside the clinic walls. So the question has always been, in collaboration with our partner Florida Blue, what are those ecosystem pieces that we can partner with to impact quality outcomes and cost of care. So there's always a lot of collaboration there in identifying with the different teams on the payer side, like medical, with network, with pharmacy. What are the areas where we can make an impact? On the patient engagement side, as we all know that, and the poll showed that is a challenging part as always. How do we convince people to seek healthcare services, especially on primary care? Depending on the population, some are more eager to go to a primary care doc. Some are more eager to start with specialty services or use urgent care emergency room services. So there's a lot of work there continuously on how do I get the right data? How do I know exactly which patients I should target? Which should I bring in the first quarter of the year? Which one should I bring later in the year? So there's a lot of work there that is done in order to engage and bring people at the right time in the calendar year. And last thing I'll mention on these bullet points here are the provider performance piece of this. So in order for us to drive change on the provider group side, we need to be very good at what we show to our clinicians, what panel they're managing, what are the clinical and health outcomes result of that panel. And that requires a lot of change in order to be accurate, because if we're not accurate with that information, the clinician is not going to accept it, and we're not going to be able to change their behavior. So with Florida Blue, with Lucerna, there's constant work on how do we build that true provider performance that can change, that can drive change. And if you can click on the next Yeah. So here, just to show you the results that Craig was mentioning. Go back, please. We, right now in the state of Florida, these are numbers that we have as of now. We're managing around 500,000 lives of Florida Blue. Our RJV is exclusive to Florida Blue members, managing all segments. You see the number of locations. These are throughout the state, south, central, west, northwest, and soon to open in other parts of the state. We employ that amount of providers and constantly working on data, bringing down appointment availability, which we know it's one of the drivers to engage correctly with a primary care doc. We have our virtual capabilities. So, we have 24/7 capabilities with our Sanitas providers. So you're never sent to an outside vendor for that on-demand virtual visit. It all stays within our ecosystem, and a lot of work on the patient experience side. We track it. It's in our value-based metrics. We talk about it every single day with our clinicians and our care teams. So this is top of mind to hit those satisfaction levels, which ultimately impact total cost of care. Okay, and a little bit more here. These are the different pieces of the playbook that we always work on, and this has been very well developed in the state of Florida. Just touch on a few. I mentioned engagement. So here there's a lot of work that needs to be done. You need what we built with Lucerna is a centralized data warehouse where we're able to see all the information in one place. So we're able to get the data feeds from Florida Blue, match that to clinical data coming from the EMR, add other data feeds, like call center information or pharmaceutical information, all to understand truly which are the members we have to bring in, quickly, which ones can wait, which ones can be done at the home setting, which ones can be done virtually. So a lot of work being done there. Mm. Craig mentioned a very important piece, which is the integration of the processes with this platform and with the provider group. So the when we develop the platform and when we use the platform, all that design is completely connected to the operational processes inside Sanitas. That is critical. It's not just another platform and another tool. The importance here is how do you tie it to what we do on a day to day and what people use and will use on the day to day work of seeing patients. And lastly, how to optimize our value-based arrangements with Florida Blue. So again, a lot of data integration, a lot of understanding what is it that we're going to measure, where the information comes from, numerators, denominators, what are the benchmarks, the goals. There's a lot of work that needs to be done there in order to, us as a provider group, get the information, show it to the operational teams, and especially show it to the clinical teams so they can change the way they practice and hit the goals that we've set as an organization.
Okay. All right. So thanks, Juan. Why are we thinking about this next? Why are we calling this next gen engagement? And where are you guys in your companies? Whether you're, we know there's folks from health plans and hospitals and providers and other places here, but what this is showing, this is an adaptation of a Gartner model that's showing as your data capabilities mature and you can move across, hey, let me get started with Can I get my engagement together in my own company across events, my own systems, maybe my own segments, my own geographies, my own channels, and then that's pretty hard, and you get some nice lift there. But really, the ultimate goal is, can you engage with your patients at all their touch points across your core ecosystem? That's hard to do. But if you work in partnership and you have the right capabilities and you're committed to it with the right mindset in your culture and things like that, you can see big opportunities to improve revenue, whether it's fee for service revenue or value-based care revenue, whether you're trying to fill appointments or reduce leakage within your system or navigate patients to, cost-effective settings for efficiency, or even, digital front doors, people using the website, patient apps, self-service for convenience, with how valuable clinical and administrative resources are these days. There's just a lot of value opportunities if you can, progress across this really transformative process there. So how do you do it? And Juan touched on a little bit of this, but it's a little bit the old people process technology. You need it all in the end. No system, no, one piece can really get you the results. But so Juan mentioned bringing the data together. Data drives. If cash is king, data drives. And it, if you're in this space and you've been around in healthcare, data is all over the place and it's very complicated and it's hard to work with. But you need to bring it together, and it's as Juan said, it's the clinical data, the payer data, claims, rosters, things like that, population health analytics, who has a care gap, risk adjustment, and then all the consumer touch points, websites, email, and so forth. So you have to bring that together. That's step one. Now you've got it and you've secured it. And so, our platform does, brings the data in from all the places, secures it in a high trust certified environment. And then what you can do is you can build out a detailed, actionable 360 of the consumer. Everything that you should know about the member patient, preferences, health status, everything, where they live, all kinds of things. You also have to have the same thing for the provider. We call that the provider 360. What's their availability? What services do they provide? Which care teams are they on? What kind of patients do they specialize in? What location, what equipment, what's their patient satisfaction score? What's their net promoter score? You know everything about the practice, the location, and the provider. Now, what Juan mentioned was what we call patient attribution and panel management, which is a fairly sophisticated analytic product that matches the right patient to the right provider. And why is that important? Well, one, for consumer preference and satisfaction and engagement. Two, for continuity of care. Juan mentioned that, in a big practice with a lot of patients, you want them to stay with their care team as much as possible. Optimizing or load balancing schedules for resources. So it's this very complicated thing to engage, match, and orchestrate. Now, to me, the most important part is you've got to connect the insight to business processes. Otherwise, you get no results. And this is where ecosystems and simplification makes it work better, where your IT has to be right, your business processes have to be right, but connecting all that insight that comes from all that data for patient care, patient engagement and growth, operational optimization, or we call operational sensitivity. You have to know what's going on inside the practice if you're going to help them and not just cause more chaos, through these processes. And then Juan mentioned performance management. So, this looks like a lot of technology and data and insights, which it is, and that's what's drive it. But notice up above, it says know-how. If you don't have the people that know how to work with the data, work with the technology, you're going to be disappointed. Okay, Juan, yes.
Yeah.
Can we go back one?
Yeah, just wanted to reinforce the importance of the attribution and panel management solution. Of course, everything is connected, but But like you said, Craig, continuity of care and accuracy of how you're measuring the clinician is critical. And we know of the difficulties with, the performance reports that we see from health plans. There's a lot of great information there, but doesn't tie directly to who's providing the service at the medical center level. So it's hard to drive change with a doctor if you're not showing them truly which are the cases they're managing. So this is very, very important in order to, get everybody on board with value-based care.
Yeah. Okay. Perfect. So I mentioned the importance of data. So what we're talking about here is a pretty sophisticated, think of it as a classic, sophisticated, almost database marketing process. Um, and what we're saying here at the top is if you don't have the data, you cannot personalize the outreach, which means your communications is not relevant. It's just generic. It's not tailored to that individual person. If you're not relevant, you're not going to get lift. Engagement really means, somebody doing something within a particular period of time. So you've got to drive action. If there's not action, there's not value. So if you think about where you're at right now, if you're working in this engagement or communications space, how much do you know about the consumer, both as a patient and as a member? You can see some of the categories here, but if you think about, for example, patient health benefits, if you know the benefit plan that each person is in, which we do because we code everybody back to their specific health plan and it's in the consumer profile or the consumer 360. If, for example, there's a $0 copayment for preventive care and you're communicating to get somebody to come in for an appointment for preventive care or their annual wellness visit or care gap closure, and you can have in the message, it's free, $0 copay, you're going to get more people in than if you can't do that. And you can't do it if you can't map in an automated, scalable fashion the benefit plan to the member. So all these things kind of tie together. But the point of this slide is, again, having the data organized in an actionable way is key. And then I'll just pick one more from the right on the provider side. Let's say you're not aware of the schedule, the provider's panel schedule. You don't know if they have capacity or not. You don't know what hours they're available. You don't want to drive patients to a provider who's not available or not to the right place, or on the weekend if they're not open, and all those. So that's an example of what we call, again, operational sensitivity. You need all these data points inside your process to really do it well. Okay. Okay, so this sounds like, makes sense, kind of a hard process to do, a lot of change, a lot of technology and people. Is it worth it? Well, how do you apply it in the business? At some point you've got to have results, right? So once you have the infrastructure in and the know-how and the data and all that, how you can use that across use cases of engagement is pretty much unlimited. It can solve any business process that involves the consumer. So whether, and by the way, these use cases are pretty much the same whether you're a health plan, a hospital system, or a provider, whether you're fee for service or value-based care, whether you're trying to, your priority is growth or increase revenue or efficiency. They're very similar. The wording's different, who it comes from, the branding and all that's customizable at scale. But, everybody wants to gain and retain customers. Everybody wants to engage in healthcare. And you see, examples of the use cases. And don't forget the operations. Behind all this stuff are people that are really working hard to operate efficiently and deliver the results. I think a good example, Juan mentioned patient satisfaction. So, we trigger on an automated basis from a checkout a detailed survey. And what that survey does, and I think, we get a 20 something percent response rate because of the techniques we've talked about. I think 60 or 70,000 responses last year of just for Sanitas. And what that does is it gives deep feedback from the consumer at the process level, clinical administrative broken down into the categories, at the location level, and at the care team level. This allows Juan and his team to not fly blindly on what's going on out there in all these clinics and to be able to make improvements. And that's important to the payer partners, and as reflected in the value-based care contracts as key metrics. Of course, the federal government puts a lot of weight on that with the increasing, ways STARS is working. So again, once you have the data and the infrastructure, you got a problem. You could stack these use cases, and you're leveraging your kind of your infrastructure investment, your team investment, and getting more value the more you do with it. Okay, want anything there, or you're good? Okay. Um, the only thing I'd like to say about the results, if you're running this process or you're a purchaser of this process, you need to know the results. And what we focus on, and of course, what's important is the business results, not the marketing results, the marketing activity results, patient open rates and click-through rates and leads and things like that. They're nice to, monitor performance of the marketing program, but what you want is completed appointments or, completed surveys or new patients. And again, if you can do it and you're measuring and focusing every day on the right stuff, you can drive, what we like to say, better outcomes and better business, which are both, really important these days. All right, I think we have now going to shift gears to provider engagement. And we've got a question here for you on this side of it.
All right, we do. I'm going to go ahead and put a poll up just like before. So you will see this on your screen. And the question is, what is the biggest challenge to engaging healthcare providers? And this is a choose one that most applies. So we'll give a few moments for folks to put in their answers.
Hmm.
And then just as before, this is a anonymous poll, and so we will show the results so you can see where you stand among your colleagues. So we've got answers flooding in here, so we'll keep this open for a little bit longer. Okay. I think most folks have voted at this point, so we'll close it down in about 10 seconds. 10, 9, 8, 7, 6, 5. Oops, get a couple more. 4, long 10 seconds. 3, 2, and 1. Okay, I'm going to go ahead and close it out, and we will share the results. Here we go. All right, are you guys able to see the results?
Yeah, yeah. I would have answered it very similarly, actually. So too much paperwork, clunky technology, top answer. And yeah, we agree that as healthcare providers, that's what we face, and that is how the healthcare system is built today. But it's what we have as an opportunity, and we've been, we pay a lot of attention and spend a lot of time thinking. First of all, how much of what a clinician does can be done by another person, in the care team, and how much of those processes can be automated and remove some of that workload off of the care team. Um, we with Lucerna, that's pretty much what we do, and in Sanitas, that's what we do, is identifying what are the opportunities to implement technology, uh, automate processes, and elevate what the care team does, in bringing them to the top of their license. Because if we don't fix that, we know it's too much for the clinicians, for the docs, to practice in this environment. There's a lot of things we ask of the clinicians these days. In the value-based models, things that docs weren't even trained to think of. Now we're asking them to do those things. So we have to find ways to help them, to give them time, to give them technology, and give them support with the rest of the care team.
One question for you. So I've seen things where the doctor-patient relationship and how strong that is and how trusted that is both ways, how the relationship, how strong that is impacts things like engagement or adherence to care plans and, those kinds of things. What's your thoughts on that? On how to improve the relationship, I guess,
Yeah,
in a very, you run a very busy practice. Yeah.
yeah, 100% agree. Everything starts with doctor-patient relationship. We, I mean, to me, the main thing here is ensuring that patient always goes to the same clinician, the same doctor. That is critical, and that's why everything we built is around that specific process. How do we
Mm,
manage a panel? How do we make sure that panels follows the same doc? That is critical, because if we break that, both sides suffer. The patient suffers because they're unhappy seeing a different doc every time, but the doctor suffers a lot too. If every patient that comes to me is a new patient, it takes longer. I have to do more things. I have to ask all the questions again. I have to change plan of care. So both sides suffer, and that's why we have to be very good at ensuring that continuity happens, truly. Okay.
okay.
All right. All right. We'll go ahead and close this down and move along.
Great. Uh, yeah. So I think we sort of touched a little bit on this. What we're showing here are the some of the challenges we face as a provider group. Um, I don't think it's a secret to anyone. There are shortage of resources, not only on the provider's side, like doctors or nurse practitioners, PAs, but on the care team. Finding medical assistants these days, it is challenging, and
Mm,
especially finding the people and the talent to practice in value-based models is even more challenging, because as a healthcare system, we're accustomed to working in fee-for-service models where you don't have to think about many other things. So that impacts the team, which, and ultimately, if you don't have the right team, it impacts the way you practice, the way you engage with patients, and the rest of other things. Mm, that data and process fragmentation, we mentioned it briefly, and it is something that we work very closely with Florida Blue to avoid that fragmentation, to receive the right data and build that into the platforms that we use for day to day. And moving to this last page, it's in order to engage the healthcare providers, we've listed here, some important things. To me, it is really important what you see here in the bottom left, which is having a clinician voice in as many processes as possible. in technology, in the operational side of the clinics, we we tend to make decisions without the clinician voice, and that is a recipe for problems, because we have to take into account how they do things, what they need, what are their expectations of the practice. That is a really important for us. um, and I'll touch on the last one to the right, which is the access to performance. Um, Again, to change behavior, to get people aligned to value-based models, you have to show them how they're performing, and do that on a regular basis. And that report, that information that you show them, has to be as accurate as possible and as real as possible. As
Hmm.
clinicians, any clinician will they're gonna question any information you show them. They're gonna have excuses and reasons that it's not accurate. So you gotta do really really good at the reporting structure that you create for them.
Okay. All right, we're going to wrap up. And again, if you have questions, we'll have a few minutes here at the end. So, we started with this is about next gen engagement and how, integrated ecosystems and all the stuff we've talked about can help make that happen. To be advanced, I view these as almost a multi-level transformation effort. So developing integrated ecosystem, that's change. And if you really want to help consumers in healthcare, you can't do it on your own because they're navigating across, lots of different companies. You have to think transformation. These are not small changes. They require mindsets and capabilities and commitment. It's a big change to be a leading engagement or ecosystem company. You've got to drive it. It's a long journey. You got to get quick wins. All that stuff. You need people who've been there, done it. You need the processes and technologies that we've talked about, and drive value along the way, and keep plugging at it. Um, and I think, it's all, the way we've looked at this and talked about it today is this is a key part of really big strategic goals. And it's in the context of consumerism, lowering costs, improving quality, winning in your marketplace. A lot of this is about brand leadership and extension, you know. So you start with big goals, you think transformation, you find partners, and then you execute the people, process, technology journey. And there's no really shortcut to it. And there's not too much in what we've talked about is optional um, in here. Now, I will say this though. One thing I want to be clear on: you don't need to have a joint venture or a full integrated ecosystem, and certainly not at the beginning, to make huge progress in engaging your consumers, whether you're a health plan members or providers with patients, and helping with support them. Um, a lot of it's the same. And if you can get to that last piece up at the top, then you're probably going to be a market leader. But you can get a lot of value along the way. And what's important for us at Lucerna is everybody's different. Everybody's goals are different. Where they're at's different. What they're focused on is different. And where you start that journey or what order you go in, um, is different, and they're all appropriate and real world stuff. And um, we like to really, for us, it's very motivating to work with leading companies and bold leaders. Because this is not incremental change and managing the day to day. It's big time stuff, and it's pretty motivating and exciting for us. And it's been great, as I said, and to work with Florida Blue all these years, and Sanitas, and also other blue plans like Blue Cross Blue Shield of Tennessee is also a big partner in all this, and different markets and segments, but basically the same story, just a little newer than the Florida one. Okay, I think that's what we had. Unless Juan, you have any ads before any questions?
No, sir. Let's get to the questions.
All
All right.
right. Well, thank you guys so much. This is a fantastic presentation. There's a lot here of course. And just so everyone knows, what's going to happen is when we're done, you'll get a copy of the recording as well as these slides. You can go back through it and watch it and review as needed. So if you have a question for either of our speakers right now or just in general, go ahead and drop it into the question module, and we're going to get to as many as we can today. But if we don't get to yours, don't worry, someone will reach out afterwards through email to get you. Okay, so first question here, and this is a question for both of you. It says, beyond the required capabilities and experienced team, are there other keys to success for meaningful engagement with patients?
Go ahead, Juan. You can take the first shot at that one if you want.
No, please do, Craig.
Well, I think there's, we've talked a lot about, I call them hard capabilities, technical capabilities and business processes. Um, I think the other one is if you start with, hey, this is a big change, we're going to have to make an investment. If the company's not really committed to it, at the top, and there's not a lot of energy and willingness to invest, if you're not worried about your brand, there's some things like that are also kind of around the edges. I think that are important, for this to really work the way we've talked about it today.
Yeah, I guess just to add, yeah, so it's really a full commitment on this type of build outs and developments. I think things that we mentioned earlier. It's how much can you build that technology to ensure you stick to that continuity of care, provide good information to the doctor. So all those things that we mentioned are key. Believing in those things and having the right teams to execute them.
Great. Next question here is, and this one I think is for Craig. It says, you talked about an experienced and expert team being key. What skill sets do they need to have?
That's a great question because this is complicated work. Of course, you have technologists and data scientists and data engineers and all those skills that make that left and middle part of that picture we showed work. But let me focus on, since this is an engagement, you know, uh, webinar in the patient experience part of the exhibit hall. Um, if you're orchestrating these communications, think about what you have to know to really do it at a sophisticated level that's driving results. You have to know healthcare data. You have to know marketing technology, marketing automation technology. You have to know, obviously, marketing, messaging, copywriting, imaging. You have to be able to do analytics, to optimize performance, and measure things. So there, it's a little bit of a unicorn to find people that can do the end-to-end process um, at a very advanced level. I think everybody that works in that space, is pretty special.
I would add, Craig, that team, they need to be very good at dealing with provider groups and clinicians. So we know we're not easy, yeah, and changing the way clinicians do things is not easy. So that to me is another important piece of whoever does these type of things.
Yeah, I would never say doctors are hard to deal with, one, but
Of course not. Okay, great. Well, actually, okay, we've got one more question here, and I think we have time for just one more. And this is, how long does it take to implement the engagement capabilities and start to recognize the results?
yeah, that's always a top of mind question. Business leaders need results, and a little bit of it depends on, I'll say, the client and how effective they are in partnering, because you do have to stand up the data. You have to collaborate on strategy and messaging and branding and things like that. I would say, as a kind of a rough estimate, Garrett, is probably about 90 days from the actual start of the implementation to go live. And then you'd be surprised how fast you can drive huge financial value. For example, the average revenue for a fee for service primary care visit with the E&M codes and any typical services in the country is somewhere around $200 a visit. And so you have providers who have, let's say, half their panel or a third of their panel open, unused appointments. And so if you can fill those appointments, you're into the millions of dollars of new revenue without any new hires or new facilities very quickly, just by, a couple appointments a day more for each provider over the course of the year. The same thing with a hospital system. If you have, which is typically 50% what they call leakage, where their primary care patients are getting advanced services, but not in their ambulatory system, you start directing them and keeping that care program integrated and that revenue within the system. You can get your payback, so to speak, very quickly. And then, as I said earlier, you stack all those use cases and you start saving operational money and so forth. For a medium-sized organization, it doesn't take long at all to be on the good side of the financial equation after your startup. So it's big. It's big if you're a typical provider or hospital or payer. There's a lot of opportunity out there.
That's great. Yeah, no, thank you. That's good to hear. And that's good news. Well, unfortunately, that is all the time we have for questions. I want to thank you both again for a fantastic presentation. As we close out here, I would like to encourage you all to swing by vbcexhibithall.com and check out the Lucerna virtual booth that they have there. The slides that we send over will have a direct link that will go there, but you can just go to vbcexhibithall.com, check it out. There's a lot of great resources here where you can see what they're doing in the value-based care world, see some different resources that they have, and interact with the team there. So, and then finally, if you would like to reach out directly to either of our speakers today, to the Sanitas team, to the Lucerna team, feel free to do so. Their contact information, or at least the individuals that you can contact on their behalf, are listed here on the slide. You feel free to do that, or I'm happy to facilitate an introduction as well. If that's easier, you can just reach out to me. But I want to thank you all so much for joining us today. Thank you again, Dr. Estrada, Craig, for joining us for a fantastic presentation. We're going to be doing another one at some point, so I hope you join us in the future. Thank you all and have a wonderful afternoon. Bye-bye now.
Thank you very
Thanks,
much.
Gary. Thanks,
Bye.
Juan.
Great.